Yeah, so we are presenting actually two works. The first one is an international prospective cohort study in patients with myelodysplastic syndromes across all the disease risk groups, meaning lower risk and higher risk disease patients. It was actually a study enrolling nearly 1,000 patients for quite a few years across different countries. And the main objective was actually to looking at the prognostic value of self-reported fatigue, so patient-reported fatigue at the time of diagnosis, as compared to the IPSS, whether fatigue could actually provide independent prognostic information beyond the IPSS classification. The IPSS is a standard and a gold standard, actually, the IPSSR prognostic classification in these patients. So basically, we wanted to evaluate whether fatigue was prognostic for overall survival. What we have found is that actually fatigue is really a prognostic independent factor for survival in this population, independent of this great classification. So this means that the perspective of the patient is pretty unique. You cannot get this information by looking at laboratory data or other type of traditional data that we are used to collect in MDS research. And I guess this is the main finding. And an additional finding is that fatigue, self-reported fatigue, was prognostic for overall survival, also in lower risk disease. Of course, you can only demonstrate that this is prognostic for survival if you have a long enough follow-up to follow patients with lower risk disease, and this is something that we did in this research. So we were pretty happy about this, and actually I have to say thank you so much to all the collaborators that we have across the world to conduct this study.